Hello, med student. Let's talk about BLS and master what is BLS. So, BLS is basic life support. It is a level of emergency medical care provided to individual experiencing life-threatening condition such as cardiac arrest, respiratory distress or respiratory arrest, or obstructed airway until advanced medical team arrives at the scene for help. Now, why BLS is so important and every person should know how to do CPR is because out of hospital the rate of survival for patient of cardiac arrest is tragically low as 10%. But with proper CPR you can potentially double the survival rate up to 20 to 40%, making CPR an important skill to learn so you can save life during emergencies. Now, how does it help a patient? The compression which you provide act as an artificial pump. It keeps the blood moving into the brain and the heart, sustaining life until a definitive care is available to the patient. This artificial circulation buys the precious time for the vital organ until the defibrillator or advanced medical team arrives and take over. So what you will do if you find a patient collapses on the ground? First thing first you have to do is to verify the scene safety. Before approaching any victim, always do a quick 360-degree scan. Look for immediate hazards, traffic, fire, or downed power line, electrical wires, because never compromise your safety as a injured rescuer cannot help victim. The second thing you have to do is to check for responsiveness. Tap the shoulder and shout, "Are you okay?" Look for any purposeful response, verbal, movement, or even just an eye opening. If the patient is not fully alert or only responds to pain or is totally unresponsive, move immediately to calling for help. So, moving on, the third step is shout for help or calling for help. In this, you have to do two important steps. The first is activate emergency medical services by calling on the emergency number. The local emergency number is 108 for the ambulance, and you have to look for AED. Step 4, within next 10 seconds you must simultaneously check for two things: pulse and breathing. You can check the pulse by palpating the carotid pulse on the side of the neck, and for the breathing you can look for the normal breathing, meaning clear deep chest rise. Gasping is not considered as normal breathing. Based on this you have three scenarios. Scenario A, if you detect both pulse and breathing, the patient is not in cardiac arrest, you have to provide supportive care and monitoring. Might be a case of hypoglycemia until the emergency medical services arrives at the scene. Scenario B is that pulse is present but there is no normal breathing. So this is the case of respiratory arrest. You must provide rescue breaths. So you have to give one breath every 6 seconds. That is 10 breath per minute and one breath per second. So it is important to remember 10 breath per minute. And crucially, check the pulse every 2 minutes, and if the pulse fade away, immediately start CPR. The scenario C is the pulse is also not there and there is no normal breathing. Then this is the case of cardiac arrest. Do not hesitate, immediately begin high quality CPR. This is where your compression can save someone's life. So cardiac arrest is confirmed and you have to start CPR. So you have to first learn about the position and the hand placement. So lower half of the sternum for adult, ensure your hand is flat and elbows are locked. And for neonate, it is two finger at center of the chest. The ratio compression is to ventilation ratio depend on your team size and the patient age. If there is a single rescuer, Then for adult and for child it is 30 compression to 2 breaths, and for 2 or more rescuer it is 15 compression to 2 breaths. For adult it's 30 is to 2, not depending on the rescuer. And for the neonate it is always 3 is to 1. So you have to remember this number and you have to master this number, as they are the difference between life and death. Moving on to next parameter, that is depth and recall. Depth is crucial. Adult compression must be at least 5 to 6 centimeter, but not more than 6 centimeter. For children, aim is for 1/3 the depth of the chest. Equally vital is full chest recall. Allow the chest to fully spring back after every compression. This allows the heart to refill with the blood. So this was all about this video.